Hello everyone, this is Dr. Vinit Kumar Rai and you are welcome on my YouTube channel Capsule. This is the trailing video of my previous video on biopharmaceutics and pharmacokinetics. In this video, I'll tell you about the absorption of drugs. So what is the absorption process? We normally study that intravascular injections are used to administer drugs systematically and these injections lead drug directly into the systemic circulation. However, the extravascular routes, such as oral administration, require absorption of drug into the systemic circulation. The drug exert pharmacological actions after absorption in extravascular administrations. So, a drug absorption is defined as the process of movement of unchanged drug from the site of administration into the systemic circulation. And as soon as and as much as drug uh, which is getting available into the systemic circulation, that will decide the pharmacological or therapeutic effect of the drug. Now, the therapeutic effect of the drug, that is the drug's concentration at the site of action. Now, drug's concentration can be measured more accurately in plasma, and we normally investigate or measure the drug inside the plasma which is getting available per unit time and the extent of drug which is getting available into the systemic circulation. So a correlation between the plasma concentration of the drug and the therapeutic response exists. So the definition of absorption takes into account the loss of the drug occurred at pre-systemic metabolism or first pass effect. We normally consider the pre-systemic and first pass effect when administered drug orally and the drug which is getting available into the systemic circulation by oral route. So here we can see the plasma drug concentration time profile, and it is well known profile of the drug into the systemic circulation, and you can see here on the y-axis plasma drug concentration and at the axis time. So it is the plots showing the significant rate and extent of drug absorption in drug therapy. So as I have already mentioned that rate and extent both are important in my previous video. So here you can see the examples. The midline shows the therapeutic level, minimum effective concentration that is required for any therapeutic effect, and above this line, and that is therapeutic level, and below this line, that is subtherapeutic level. It means in both the profiles, the drugs are getting available into the systemic circulation completely, but in the first case, the rate of the drug which is getting available into the systemic circulation is high. And in the second case, here, in the second case, the drug which is getting available into the systemic circulation, the rate is slow and extent is same. Here, the rate is high, but the extent is same as second graph shows. So, in the second case, the bioavailability will be low because the rate of the drug which is getting available into the systemic circulation is low. So that is why the rate and extent both are important. In the first graph, you can see that successful therapeutic effect of rapidly and completely absorbed drug, and the second case that is the therapeutic failure of slow and partially absorbed drug. I think you all are getting this point. Now the absorption process. In this process, a complete but slow absorption fails to exert therapeutic response. A rapidly absorbed drug attains the therapeutic level easily to elicit pharmacological effect. So rate and extent both are important. Thus, both the rate and extent of the drug are important, as I have already said. Now, such an absorption pattern has several advantages. If the rate and extent both are high, then um, the same graph will show the several advantages like lesser susceptibility of drug for degradation or interaction due to rapid uh, absorption, higher blood level and rapid onset of action, and more uniform, greater and reproducible therapeutic response you will get. So these are some of the advantages of highly bioavailable drugs. Now, routes of drug administration. Uh, the most important is the enteral route, which include the pre-oral, that is gastrointestinal, sublingual or buccal route or rectal route. And the GI route is the most common for administration of majority of the drugs. And in US, most of the dosage form which are getting developed are meant for oral route. Now the parenteral routes, it is given directly into the systemic circulation and it includes all routes of administration through or under one or more layer of skin, which while no absorption is required when the drug is administered IV, and it is necessary for extravascular parenteral route like subcutaneous and intramuscular routes. Now the topical route, it includes the administration of the drug on the skin, eyes and specific membrane, and the intranasal, inhalational, intravaginal and transdermal routes may be considered enteral or topical according to different definitions or conditions. Now the route of administration, as we have already discussed, that parenteral routes, in which the first one is the intravenous route. You can see here it shows 100% absorption of the drug and it provides both immediate or controlled relief. The dosage form developed for intravenous administration may show both immediate or control effect and suitable for injecting even large volume of the fluid into the systemic circulation, and it is suitable for irritating drugs also. The disadvantages of this system show high chance for adverse reaction, possible anaphylaxis, requires skill for ingestion of infusion site and tissue damage at the injection site. So at the time of emergency, we cannot retrieve drug from the systemic circulation. That is the major disadvantage of this dosage form. The second one is intramuscular. It is that shows the rapid and slow absorption from aqueous solution. Uh, the rapid and slow absorption from aqueous and non-aqueous solutions respectively. So if the solution is aqueous, then it will show rapid absorption, and if aqueous solution is non-aqueous, it will show slow absorption. So advantage of this route is easier to inject than intravenous route, and large volume is used than subcutaneous solutions. Disadvantage of this system is that the irritating drugs can be more painful at the site of administration and the variable rates of absorption depending upon the muscle group injected and blood flow. So in the third case of parenteral route, that is subcutaneous, it shows rapid and slower absorption from the aqueous and depot formulation respectively, and generally used for vaccines and drug not absorbed orally like insulin, जो ड्रग orally absorbed नहीं होता उस केस में. Now the disadvantages of this system is the rate of drug absorption depends on the blood flow and injection volume. So that is the major disadvantage of this system. The routes of drug administration. Now in the next, the route of administration, that is enteral route. It includes buccal or sublingual. It is meant for rapid absorption of lipid soluble drugs from the oral or mucosal membrane. No pre-systemic metabolism. It avoids the first pass metabolism, and some drugs may be swallowed. That is the major disadvantage of this system. not for most drugs or drugs with high doses or molecular weight. So these are some of the disadvantages of this route of administration. Next one is rectal route, and absorption may vary from suppository to suppository, and more reliable absorption from enema solutions. The advantages of this system is that it is useful when patient cannot swallow medications. So we can use rectal route and use for local or systemic effect both. And disadvantage of this system is that absorption may be erratic. Different types of absorption mechanism can be seen, and the rate and extent can be different for different dosage form. And suppository may migrate to different position. Suppository moves in the rectal environment from here to there. So that these are the major disadvantages of this system, and it is not so much comfortable also. The next route is oral, that is meant for the absorption of the drug into the systemic circulation by GI tract, and generally slower absorption rate compared to IV bolus or intramuscular injections. And advantage of this system is that it is safest and easiest route of administration, and it is suitable for both immediate release and modified release of release dosage form. Disadvantages of this system is that some drugs are unstable in GI tract. Therefore, we cannot use this route in such cases, and some drugs can go into first pass metabolism or meso erratic absorption from GI tract. So the other routes which are considered for other drug administrations are transdermal route, and the bioavailability of the drug in this case can be low because of slow absorption rate, and it may vary from location to location, and increased absorption with occlusive dressings. If we use occlusive dressing, absorption may be increased. Advantages of this system are that these systems are easy to use and withdraw at any point of time, and these are meant for continuous release for a specified period, and used for liposoluble drugs with low dose and low molecular weight, and low pre-systemic metabolism, because these routes are meant to avoid the first pass metabolism by oral route. And major disadvantages of this system are that some irritation by patches may occur, and permeability of skin variable with condition, anatomic site, age and gender, and types of cream or ointment bases may affect the drug release and absorption. So these are the major disadvantages. Now the next route of administration is inhalational. This route of administration may show rapid absorption of the drug from the inhalational route, and total dose absorbed is variable, and may be used for local or systemic effect. These are advantages of this system, and major disadvantages of this route of administration is that the particle size of the drug determines anatomical placement in respiratory tract and may stimulate cough reflex, and some drug may be swallowed by this route of administration. So this is all about this topic, that is absorption of the drug, and this is the introductory part of this topic. And the next topic we will discuss about the gastrointestinal absorption of the drug. So keep watching us. Thank you so much.